Hello, I'm Dr. Peush Bajpai. I'm the Director and Unit Head of Medical Oncology at Max Hospital, Dwarka. So today I would want to emphasize how immunotherapy has actually made a great paradigm shift in cancer care, in medical treatment. So immunotherapy, as we understand, is basically a treatment which is basically harnessing our immune systems. It actually activates our T cells, the fighter cells in our body, which actually go and kill the cancer cells. So immunotherapy earlier was used in advanced stage cancer. Now we are understanding that the importance of the immunotherapy over the last decade, it has transformed and actually has advanced into early stage and neoadjuvant settings also. Today I would be highlighting the importance in hepatocellular carcinoma. So where in hepatocellular carcinoma, especially in advanced stage hepatocellular carcinoma, it was used. Now it is also being used along with local therapies as in TACE and TARE. So that is what I would say, that the real success lies in how we integrate immunotherapy into multidisciplinary treatment. And immunotherapy per se does not replace other treatment, but it is strengthening the entire cancer strategy. So we can actually see and position our local treatments whenever we find a good response to immunotherapy happening. So with that, I would say that cancer care is all about multidisciplinary care. Thank you.